Doctors have to be able to interact with patients, whether that's an examination, taking a history, or just delivering bad news. And if that's the case, that means inevitably medical students have to be tested on these clinical skills. Which brings us to the OSCEs. These are practical examinations that medical students have to go through. And whether you're already a medical student or next year you might be starting, I'm going to give you some general information and advice in this video on how to approach preparing for that, as well as things to look out for. Welcome back to Aussie Med Shoots. My name is Francis, and if you're new here, I'm a final year medical student at the University of Sydney. On my channel, you'll find videos about medicine, medical school, and getting in. So if that sort of content interests you, or you find this video quite useful and want to see more of this stuff, then definitely like, subscribe, and leave a comment of your own advice or questions that you might have. There is so much to cover when it comes to preparing for OSCEs that there was no way I was going to fit it into a single video that's not going to take 20 minutes to get through. So what I'm doing in this video is giving some general advice, and I wanted to make sure that it's short so that I get it out in time for people that are approaching OSCEs, but also that it's still interesting to people that are going to be starting OSCEs next year. Because of that, I'm going to still have some more specific advice on individual stations in my next video, which I've already written out the information for, so hopefully I'll get that out really soon. What are OSCEs? I don't even actually know what it stands for, so that shows how unimportant the acronym is. You can learn it if you want to, but essentially it's a practical test to see how your clinical skills hold up in a pseudo-clinical environment. They're going to test things such as your examination skills, like a cardiology examination, or your history taking abilities, so something like a diabetes history. They can also potentially test your procedural skills, so things like inserting a nasogastric tube, and occasionally you might get interpretation of investigations, so having a look at an x-ray or blood results and saying what you see, what's abnormal, what's normal. Depending on your university, you might get an acting station, which is going to involve either breaking bad news to somebody that's pretending to be a patient, or perhaps comforting an anxious patient. Now, your OSCEs are going to differ depending on the university you're going to, but what they're looking for in each particular type of examination and every type of history is going to be fairly similar. Additionally, the way you're going to prepare for these is pretty much going to be the same regardless of what university you're at. What's going to change is what they test at different year levels and at different stages. OSCEs are a lot like MMIs if you've done a multiple mini interview to get into medicine. They line you up in a hallway with a number of doors. Each door has a prompt on the outside of it, and the prompt gives you some information on what you need to do when you go into the room. If you're in first year, this information should be pretty clear. Something like, this is how the patient came in, and we want you to do this examination, or do an appropriate examination, or take an appropriate history. So you get a few seconds, 30 seconds to 2 minutes outside of the room to have a look at the prompt and try and plan what you're going to do. Then you'll get a signal to go into the room. Once you go into the examination room, you will see that there is an examiner. Be pretty clear because they're going to be sitting with a chart on the other side of the room. You might see a patient, so somebody that's sitting at a table and sometimes has a script on what to say, or they might be sitting on an examination table ready to be examined for whatever it is you need to do. The university should tell you how much time you get to do this. However, for me, I think it was like 7 to 8 minutes. Once you finish the station you're in, you walk out of the door. You don't have to stay in there until the time is up. And then you get another signal to move to the next door. Everyone rotates, and then each door has a different station until everyone's done. If you're in a lockdown situation, you might be doing your OSCEs over Zoom, which means that it would be very unfair of them to try and get you to do an examination. What they might do instead is get you to do some histories, and then instead of getting you to do a procedural skill, they might get you to explain the process of the procedural skill. In first year med, especially if it's via Zoom, it's reasonable for them to ask you questions at the end. However, at Sydney University, those questions afterwards weren't graded. It was usually just if the examiner wanted to ask you a few things to kill time, I guess. Now, on to my advice on how to actually prepare for these examinations. The first thing you're going to want to do is figure out what the different types of stations that you could get are. Hopefully your university is nice and they've released a very clear guideline of the different examination, history, procedural techniques that they expect you to know for your particular stage and year level. Your next best bet is going to be talking to your upperclassmen, people that did this the year before or a couple years before and can tell you what they went through. Or they might even have a document that they've circulated that explains going back 10 years each year what the stations were for your year levels OSCEs. Finally, there's another document that sometimes circulates for different universities that includes all of the different station types, so all the different physical examinations, history techniques, procedural skills, and investigations, as well as a few steps on what to do for each of them. That information isn't necessarily going to tell you what the high yield things are, and sometimes these OSCE Bibles are 10 years or potentially even older. For the most part, the different things that different universities will examine in their OSCEs will be the same across universities. It's just the year level that they examine them at that might be different. That being said, see if you can find the OSCE Bible that's specific to your university and your year level. Just have an ask around of your fellow students and see if anyone has one already. Once you've figured out what the potential stations are, the next thing you're going to want to do is figure out the steps that you need to do for each of those different types of stations. So if it's an examination, what are the different steps you need to do for the exam? Now, you might think that a consultant who is a specialist at maybe cardiology would be an excellent person to teach you how to do a cardiology exam. However, they are so far gone from the style of testing that we need to get through. Things like, I have never seen a consultant ever check for the Shamroth window between somebody's fingernails to see if they have finger clubbing. I've never seen that, but it was definitely something we were expected to look for on our respiratory examination. The stuff that they need to know for their job is so much more specific, and they also know that some different techniques are just really unuseful in their actual work. And so if you're examining a patient around them, they might not pick up on things that you're not doing that you need to do for OSCEs. Additionally, consultants will usually get you to examine an interesting sick patient so that you can really learn what sick signs look like. But in your first year for your OSCEs, you usually don't get tested on actually sick patients. It's just a healthy person that you need to do an examination on and show that you've memorized the steps that you have to perform. It's an act. You're going to hear that a lot. You're basically going to memorize a script and try and get through it. So what about junior medical officers then? So people that are interns or first year residents. These are people that have gone through what you've gone through quite recently. So it's all fresh in their head. If you do an examination or a history in front of them, they're going to be able to tell you the things that you need to do differently for the OSCE specifically. So if they have time, this is an excellent resource that you should take advantage of. All of that being said, you do not need to get clinical exposure to work out the steps that you need to do. A textbook you might hear about is something called Tally O'Connor's. This is an excellent resource for people that are doctors and need to have very in-depth knowledge about the techniques that they will be tested on. I think for first year, second year, even fourth year medical students, Tally O'Connor's is way too detailed for anything you're going to need to do. Do not learn all of the steps in Tally O'Connor. It is almost always more than you need. What it is useful for at our level is if there is a particular technique within maybe an examination that you want to know more information about, you can go to that and it will give you more information. It's also written by people with a sense of humor, so it's fun sometimes to find the little jokes hidden throughout the text. What about upper year students, people that have done the examinations 1 year, 2 year, 3 years before you? Unlike junior medical officers, they might not be quite as refined, but it will be even fresher in their head, and they might be able to tell you the exact stations that are high yield and the steps that they really want to make sure you look out for. Finally, you've got 2 more resources. One of them is Geeky Medics. That is my gold standard for how to prepare for OSCEs. For our level, you can watch a Geeky Medics video on a particular examination technique and you're going to know how to perform that exam well enough to pass, if not do extremely well. I don't know if they have many histories, but all of their resources are free unless you want to get a phone app, which costs like $20 for the year and is 100% worth it. I think all of that being said, you're going to balance out your approach with all of these different resources, but I probably wouldn't spend too much time worrying about if you've seen patients on the ward, especially with a consultant. Unfortunately, this video is already longer than what I wanted it to be, so I'm going to cut it off here. However, I've already filmed the next part, which is about general advice on preparing. So once this video is up, it should only be a few more days before I get the next one up. And then after that, I am going to get stuck into more specific advice about each individual type of station. So until next time, good luck.